I'm Dr. Kshama Wechalekar. I'm Head of Nuclear Medicine and PET at the Royal Brompton and Harefield hospitals, which is part of Guy's and St. Thomas's Hospital. I have been in this trust, believe it or not, for more than 23 years. So in different capacities. So I came from India as a trained nuclear medicine physician, and after coming over, I did an attachment at Royal Brompton Hospital just to see how it is practiced in the UK. And the opportunities came in my direction, and I became a registrar in Royal Brompton and also Royal Marsden Hospitals as a rotation. And at the end of it, I got a locum consultant post, which then led to a substantive post. And within a year of being a substantive consultant or two, I was made head of nuclear medicine department. And since then, my journey has been quite exciting, and it's been fun being in the trust.
Yeah. What first drew you to medicine, and how did you come to nuclear cardiology as your specialty?
It's a very interesting question because nuclear medicine is not very well known to medical students. So when we are doing when we are doing medicine, you don't hear about nuclear medicine. There's not much information in textbooks to think that there is a specialty like that. When you're easily exposed to CT scans or MRIs that you hear about, and those investigations are done routinely for patients. But this specialty didn't sort of exist for medical students at the time, and even now things have not changed very much. So I was always interested in physiology and the workings of the body rather than just the anatomy. And then I was interested in medicine. And then came up an advertisement in a newspaper saying this is a nuclear medicine post. And I was also interested in physics and radioactivity. So all those sorts of things came together in this nuclear medicine trainee post, which was highly competitive. And I managed to get in the sense that I was selected in the interview amongst 200 candidates, and I made the most of it, I should say. I loved it. Didn't love it to begin with because it had maths, computational sciences, compartmental modeling, statistics, and I got quite distressed thinking I didn't come here to learn maths. But it all came together in the end, and then it made it into a very extensive but quite basic understanding of nuclear medicine at the time. I did post-graduation in Jaslok Hospital in Mumbai for another 2 years, called as a DNB, and then interestingly I got married, and my husband was working in the UK, so I came along with him. And then I passed the exams that are necessary here to be practicing nuclear medicine in this country, did my CCT, and rest is what I already told you.
Brilliant. Going back a few years, what advice would you give to your younger self?
I think my advice to myself would be to follow the dream. Follow what you like, find your niche, and do not be afraid to do hard work. Because without hard work, medicine does not really happen to you. It's something that you really have to invest your time in, and understanding who you are and what really ignites your fire, what really makes you feel that you will make a change. And I was always interested in not the usual branches. I was always looking for unusual branches of medicine, like industrial medicine or aviation medicine, and nuclear medicine actually struck a chord for me.
And to students nowadays, would you say that experiences like observership or fellowship do really help in understanding what career path to go in towards?
Absolutely. I think no one should go blindfolded into a specialty which someone directs them to do or they think it is right for them to begin with. They need to experience it, they need to understand it and see themselves if they will like it, if they will see them in future working in that specialty, and then they should enter it. for the young medical students, there are many new branches that will open up, which are, even not ready for now. And medicine is all about culmination of different specialties, different combinations, chemistry, physics, biology, all of them turn into something else, and they come together in medicine. Um, for example, pharmacology, then there is biochemistry, all of these things come together, but these are the basic blocks. But on top of that, there are so many other things like AI now, which can be incorporated into medicine, new specialisms that are coming through genetics, and variety of other new possibilities of finding new antibiotics or tracer kinetics, which we practice. These are new branches, so they need to explore what they would really like to do in future, and then partake into that direction rather than just following peers or just following career path that has been led by their predecessors.